I'm very pleased to be here to just discuss at a high level some of the important provisions that are in the Health and Human Services Finance Division bill. So first of all, I know you're all aware, we include in our bill the repeal of the sunset of the provider tax. It is so critical to the future of our state and our ability to continue to innovate in healthcare, in addition to maintaining coverage for over 1 million Minnesotans. But the Healthcare Access Fund, as everyone knows, also provides for health, for better health for all of Minnesota. It is critically important. It has helped us have better health as a population, and we'll continue to do that if we keep that fund. We also have pieces in the bill that I know you've heard about that come from the governor's One Care program, including affordability pieces for people who are buying their insurance in the individual market. This is only about 155,000 Minnesotans, but those people are really finding it very difficult to stay covered. And as the speaker noted, even people who have insurance are finding they don't have access to health care because of the high out-of-pockets. So we have pieces in there that help people afford to buy insurance, and a product that will come online in a few years under this plan that will provide an option with much lower out-of-pockets, thereby allowing people to have access to real care, not just something they can call coverage. There's a proposal in our bill also that holds insurance companies to the promise that when you buy their policy, you actually will have access to care. This is something that technically is called network adequacy. We are improving it in this bill. It's basically regulation that ensures that when they sell you a policy, you can actually get the care that is promised to you under that policy. One of the really important things I want to mention that is in our bill is the first increase in cash assistance to families on our MFIP program, the first increase in 33 years. This is really important. I think it is a bipartisan shared interest, but when you think about the fact that families on our family investment program, a family that was on the program 33 years ago would today be getting, would have gotten then the same cash assistance a family would be getting now, and having to live on that amount of money, that's pretty shocking. And so we're really proud to be able to change this because it impacts the lives of many, many children in our state. So we have a lot of bipartisan bills in our omnibus bill. We believe that this bill will do a lot of things for Minnesotans. It will lower prescription drug costs for all Minnesotans eventually, not just for our public programs. This is extremely important to us because, as the speaker noted, Minnesotans are struggling with higher and higher prescription drug costs, and that is a big piece of escalating healthcare costs in our state. We're lowering the cost of healthcare in other ways as well. We have provisions to help reduce health disparities in the state so that more of our people can get a good chance to live a full life. We especially want to improve, and maybe Representative Moran will speak to this, but child protection services to try to reduce trauma for children and give more children in our state a better chance at a full life. Other things, women's health, the speaker mentioned. We have increasing access to birth control. We have improvement of breast cancer screenings. We have some pieces to really, for the first time, have to try to prevent sexual assault and domestic violence, and even more. It's a hard bill to talk about because it covers so many wonderful things, and we're really excited. Of course, no bill solves all problems, but this one makes a darn good start on improving healthcare for Minnesotans.